Utilization of neuroplasticity in its finest form. Decades of research. Finally, a real answer. Welcome to this exciting entree to rehabilitating brain and central nervous system disorders. Introducing Dr. Ronald Kalanko, founder.
Hello. We chiropractors have always been abundantly concerned with the tragic pharmaceutical abuse of treating attention deficit disorders and attention deficit hyperactive disorders, which has become America's #1 childhood and adult behavioral disorder. With my personal experience of literally saving our grandson's life prompted us to pursue solving brain disorders and the rehabilitation. Our approach to the grandson's care was to use creative thinking with unique application of natural alternative therapies and remedies, and using my extensive clinical experience with applied nutrition, bioenergetic testing, and procedures associated with chiropractic treatments, and wonderful aid from other clinical disciplines proved to be successful. We believe that alternative natural procedures without the pharmaceutical toxic side effects, including drug addictions, suppression of creative thinking, reduction of communication skills, and overall social behavior problems, could be treated successfully. Research has shown that young children placed on a regimen of narcotic products can produce a permanent diminishment of the innate intelligence, otherwise known as IQ. We also realize to be able to reach the maximum out of those that need help with attention deficit and attention deficit hyperactive disorders and other central nervous system disconnect disorders, there has to be a structured patient care program. The program needed to have oversight by a physician that would insist upon compliance. Not all doctors have an extensive background in diet, nutrition relating to the central nervous system. Rehabilitation program that would yield consistent, successful outcomes. The program needed to be designed for an easy learning experience and adaptation to the doctor's practice. The program must be easy for the patient to understand, implement, and appreciate the significance of the responsibility of compliance to the doctor's orders. The task of researching, formulating, and developing products that would be safe, compliant, and therapeutically consistent in their effective clinical outcomes was pursued by my friend, business associate, colleague, and formulator, Dr. Michael E. Whitman, BSDC FACACN. One is minimally needed is a modified diet, void as much as possible of pollutants, sugar, refined carbohydrates, omega-6, and grossly processed vegetable oils that are terribly inflammatory. The author, David Perimeter's book, Grain Brain, illustrates the importance of diet and disconnect disorder syndromes. Brain Bright Care Program formulates the necessary diet changes and the use of the Brain Bright Micro Synergistic Nutraceuticals that is needed to be dovetailed into the overall program. This couples with the other proprietary Brain Bright Care Program's adjunctive physicians protocols, using a variety of therapeutic physical therapy modalities, including physical and mental exercise. Balancing the central nervous system through chiropractic manipulation, laser, and oriental medicine. Acupuncture, to name some of the adjunctive protocols. During the middle of the 20th century, the famous Dr. Linus Pauling, PhD, neuroscientist, the most revered chemist of the century, He lived 1901 through 1995. He researched alternative medicines and was the father of nutraceuticals. He used orthomolecular treatment of megadoses in the successful treatment of schizophrenia and other psychiatric and cerebral disorders. He failed in the last arena of treating the common cold, in which he used megadoses of vitamin C to combat the condition and failed. Big Pharma moved in, and his area of research was changed forever. In spite of his past successes with the schizophrenia and so forth, Big Pharma pelted him with their enormous financial and political support. Losing because of his common cold failure, not considering the momentary victory, the megadoses of his nutraceutical program were never accepted by the general populace. We are knowledgeable of neurotransmitter treatments with serotonin and dopamine, causing a symptomatic relief function only. There are no effective changes in the etiology of the disease. It is not a repair and healing procedure. It is only a safer process than that of a pharmaceutical nutraceutical procedure, not a repair healing process. Brain Brilliance has Brain Bright Micro Synergistic Nutraceuticals, having the benefit of sophisticated, minimal to small amount dosage when synergized creates a macro-large crescendo of repair and healing without a caustic effect, no toxicity. Brain Bright Care Program coupled with its Brain Bright products affords the necessary approach to help the body heal itself. Brain Bright Care Program affords therapeutic modalities to address the central nervous system imbalance through anti-inflammatory dietary modifications with our special Brain Bright Care Program, chiropractic manipulation, bioenergetic procedures, aerobic, physical exercises, mental exercises, diet, products that cross the blood-brain barrier and circumvent the menacing chronic histaminic syndrome, facilitating detoxification and avail the needed and necessary proper nutrition to aid in the health of the central nervous system. Compliant groups of products using rapid uptake absorption through the mucosa of the lining of the mouth, tongue, and pharynx. Provided in the form of 2 spray products, Detox and Enhancement, and 1 powder product, Knight. Physician oversight of compliance aids the program. Brain's Brilliance products, Brain Bright Detox, helps to remove toxic metals, chemicals, allergens, pathogens from the central nervous system. This helps the body reduce the inflammation and its source. Few detox products or procedures specifically address the central nervous system like Brain Bright Detox. Brain Bright Enhancement has very small amounts of micro synergistic blended nutrients to enhance neurotransmitter function, helping to repair and heal disconnect disorder syndromes. Brain Bright Knight, a very pure source of virgin grass-fed cow's whey, blended with central nervous system micro synergistic nutrients to feed the central nervous system. Also, recent studies performed by highly respected research teams in Europe discovered interesting information. Long-term clinical trials were performed. One group died without neurodegenerative diseases, post-autopsies, had no presence of cranial yeast, candida, or other organisms. The second group died with neurodegenerative disorders and post-cranial autopsies exhibited yeast, candida, and other organisms. Positive clinical outcomes must be reflective of the benefit of the Brain Knight Care Program and its Knight products. Important information is that the Brain Brilliance program addresses the feel-good neurotransmitter dopamine. It begins to decline around age 45. If the decline is allowed to progress unchecked, it can translate into depression in some cases, lack of motivation, decrease in libido, and not looking forward to enjoying pleasurable events like they used to, it can be potentially progressive into Parkinson's disease and dementia. Low dopamine levels in children due to diet, medications, vaccinations, toxic metals, among the other central nervous system disruptors, leads to attention deficit disorder, attention deficit hyperactive disorder spectrum. Low dopamine levels at any age can lead to addictions. Drugs like cocaine give a huge dopamine rush. Similar occurrences with derivatives of methamphetamine, sugar, tobacco, alcohol, even the act of gambling and sex creates a dopamine rush and become addictive. Brain Brilliance Brain Bright Care program is designed to repair and heal neurotransmitters such as dopamine and serotonin. If one is trying to stop smoking, lose weight by cutting back or sugar and refined carbohydrates or other addictions, the Brain Brilliant Brain Bright Care program with Brain Bright Micro Synergistic Nutraceutical products could be a dramatic aid to a successful outcome. Over the years, the thrust of our collaborative efforts led to developing the Brain Bright Care program, Brain Bright Micro Synergistic Nutraceutical products, the Brain Bright Care program physician adjunctive protocols, and most importantly, the doctor-patient health team concept. The studies and research made it very apparent that to produce a successful outcome in the care of brain and central nervous system disconnect disorders required infusion of multiple disciplines. Chronic inflammation is the common denominator in all disorders. Menacing chronic histaminic syndromes, inflammation, provides the centrum of these disorders. Histamine is naturally present in the repair and healing process of injuries, infections, lacerations, and many other inflicted traumas. As a healing progresses, histamine should begin its departure from the area in question. Too frequently, it does not depart but lingers, thus causing a pooling of cellular metabolic waste that impairs normal circulation, required to bring in proper nutrition and remove of waste. All blood and lymph function is impaired. Nutritional elements, oxygen, pharmaceutical entries, and removal of waste is hampered. Inflammation abounds and causes a self-unstable propagation that encourages additional inflammation. Some of the etiologies of all disorders can be linked to chronically poor diet, improper volumes of potable water, and poor quality water ingestion, encountering toxic metals, chemicals, and overwhelming environmental hazards, overindulgence of alcohol and food, illicit use of prescription and illegal drugs are among the culprits of disease. These stressors of health eventually cause the immune system to be effectively depressed and overcome, making the body very susceptible to viruses, parasites, bacteria, and other organisms eliciting inflammation, thus enhancing neuroinflammation and disconnect neurodegenerative diseases. Research has shown candida prevalence in chronic inflammation conditions such as dementia and Alzheimer's disease. In these conditions, the central nervous system is out of balance, unable to properly manage the billions of cells found in our bodies. As these tissues fall in disrepair, disease becomes rampant. Big Pharma has failed to understand the need for an all-out assault on the patient's central nervous system disconnect disorder. One drug, one surgical intervention, one nutritional element, special diet, one physical therapy, a chiropractic adjustment, laser or acupuncture will definitely not resolve these conditions. It is the fact that they all provide some benefit and may take a small step forward, allowing some level of relief, but not a repair and healing. What is needed is an outright assault with everything we have in our arsenal to attack with force these difficult diseases. The body requires an abundance of help to assist in it regaining a toehold of quality health. Brain Bright Care Program approaches these needs.
I hope you enjoyed the presentation. We invite you to visit our website and review many clinical outcomes and research behind the development of the program, products, and their pricing.